Alright, so today we are doing some taping with kinesio tape. This is actually Rocktape, but we're working on Nicole here. She has some irritation in her knee. X-ray shows that there's nothing extreme going on, so we're just going to get some extra support. Again, what this tape does, it does give some stability to the joint that you're taping, but it still helps you keep mobile, unlike typical athletic tape. And it also helps lift the skin and the fascia underneath so that blood and lymph can flow underneath as well to help recover from injury, or, again, with that stability, keep from making an injury worse. And so with the knee, first thing that we do is we start with a stability strip across the top of the tibial plateau down here. So we actually stretch across, get a little bit of that open knee capsule at the bottom, come across, and then once we have that set, you lay the ends with no stretch at all. And then we run over it a little bit, just get some heat on this tape to activate it. That'll make sure that it stays. And then we will lay the strips down that will get more of that lymph and blood flow by lifting the fascia. So come across, measure, make sure we're going to be clear where we want to lay to. And for this, we'll just get the anchor set. It's going to be right here. There are a number of different ways to tape. We're doing this one today, but there are other versions where you can actually come down and across and wrap over. We're just doing a really simple one today though. So we give a little bit of a stretch coming down, not very much, and then lay at the end with no stretch. Run through and give it some heat to activate it, make sure it stays. Move on to the other side. And again, we'll start with the anchor first. And just a tiny bit of stretch. We don't want to do much here. Go around that spacing where the kneecap is, come back across, and lay it down. Ideally, with a perfect lay, this one would actually come down onto the skin, would be a little bit better, but this will be just fine as long as she doesn't go too crazy on a workout right after this, or goes and takes a shower right afterwards. She'll be alright. Typically with taping, you want to give yourself 2 hours before shower. Ideally, perfect world, you want to take about an hour before exercise, just so it has a little bit of time to set in. And so if you do want to work out after this, we'll just talk about ways that you may want to modify it so it can actually make sure it sets. And that's really a way to tape up the knee, give it some stability, keep her from hurting herself any worse. And then we'll talk to you guys next time. Thanks.